Um, Good evening, everyone. Today, for my oral case presentation for FNP 596, I'll be discussing about a patient that came to my clinic. She was a 55-year-old female. She had complaints of an acute pulmonary issue. She was dealing with an annoying cough that was associated with some upper respiratory symptoms. So her chief complaint was she was a 55-year-old non-Hispanic Caucasian female. Excuse me. And she was a reliable historian. Her chief complaint, in her own words, was she's had an annoying cough, or I've had an annoying cough and runny nose for the past 3 days. So for the past 3 days, she's been dealing with this cough. She is a 55-year-old female, Caucasian female. She did come to the clinic alone and presented her acute cough and nasal congestion. They started about 3 days ago when she was exposed to a coworker who also was sick. She has a dry, hacking cough that's worse at night and with talking. It's a 5 out of 10 in severity. She states that it is also interfering with her sleep, but she's not having any shortness of breath. She does have clear rhinorrhea, mild sore throat, postnasal drip, and some fatigue. Some aggravating factors was that she, when exposed to cold air, it makes it worse. And relieving factors would be when she drinks plenty of fluids to wash down the mucus, and over-the-counter guanfacine. She's been using about 2 to 3 times a day. No fever, chills, wheezing, or chest pain. No blood in her sputum, and no recent travel. So she's coming today because she came to the clinic last week because the over-the-counter medications weren't working after 3 days. The pertinent negatives would be that no recent antibiotic use or known exposure to COVID or flu. No chronic respiratory issues are currently being taken care of with this patient. She does have a history of hypertension and hyperlipidemia. She does get all of her routine visits, mammogram, pap smear, colonoscopy. She's up to date on her flu and COVID vaccines. No surgeries or hospitalizations, and she is postmenopausal at the age of 50, starting at the age of 52. Excuse me. So she is on medications. She does take lisinopril for her hypertension, 10 milligrams, atorvastatin, 20 milligrams for hyperlipidemia, and she's been taking guanfacine as well for every 4 to 6 hours for the cough as needed. No drug allergies, and she doesn't know her father or her grandparents. She just is raised by her mom by herself. So, but her mom has some seasonal allergies. She never smoked, drink, or used drugs. She does use caffeine, 1 to 2 cups a day, not sexually active. So for my review of systems, she has been fatigued, but no chills, fever, or weight loss. Eyes, ears, nose, throat. She does have the rhinorrhea and a sore throat. But no ear pain, no chest pain or palpitations for cardiovascular. For the pulmonary, she does have the cough, no difficulty, no dyspnea, no difficulty breathing or wheeze or blood in her sputum. For the GI, no nausea, vomiting, diarrhea, and no difficulty urinating for genitourinary. No musculoskeletal issues, no neuro issues or psych issues or allergic immuno issues. Her vitals on her visit, she weighed about 145, 5'5", 98.6 oral, so no fever on presentation, 78 heart rate, blood pressure 128/76, and respiratory rate of 16, O2 sats 98% of room air. So the general appearance overall, no acute distress, speaking of full sentences, Nasal mucosa was erythematous, but clear rhinorrhea, no sinus tenderness, and cardiovascular regular rate rhythm, no murmurs, rubs, or gallops. Respiratory rate was about 15, 16, and lungs were cleared auscultation bilaterally with no wheeze, bronchi, or rales. Soft, non-tender, gastrointestinal, soft, non-tender, and no abdominal complaints. Cranial nerves were intact, and no labs are ordered at this current visit. If she has this persistent issue going on for longer than 10 days, we'll maybe get chest x-ray or something, and she can follow up. But she was informed to go to the ER if she has any increase in shortness of breath or anything like that. So it's a classic representation of an acute viral upper respiratory infection. And for my ICD-10 J06.9, she was exposed to a coworker, and then that was when she got sick. She does have the rhinorrhea and the sore throat, the dry cough. She no bacterial signs like a high fever or purulent sputum. Abnormal, no abnormal lung exam. Per the CDC guidelines, we're not going to use antibiotics. My second was going to be acute bronchitis, but persistent cough, less likely, non-productive sputum, going with the upper respiratory infection. And my third was postnasal drip, but she's not having any sneezing or itchy eyes, so it was a low priority. So my diagnosis was acute upper respiratory infection with an acute cough. My plan was just support her, no antibiotics at this time, continue the guaifenesin, and as needed, and take some honey lozenges, Motrin as needed for the pain. And told her about that it's a virus and it could take up to 3 weeks for her to get better for the cough, but the symptoms should resolve within the next week or two. But encourage to rest, have humidified air, honey, tea, saltwater gargles, and continue the over-the-counter medications. Make sure she's covering her mouth when she coughs, and hand hygiene. If worse, to come back. All right, thank you guys for coming and watching my presentation. Have a good day.